It is important that all staff understand the procedure for measuring lying and standing blood pressure. This is an important part of assessing a patient at risk of falls. In a number of cases where patients fell in our care and suffered harm as a result of the fall, lying and standing blood pressure had not been carried out, possibly contributing to the fall. A fall in blood pressure on standing is common amongst older patients. This is referred to as postural hypotension. The drop in blood pressure is often greater when patients are taking antihypertensive drugs or diuretics, patients have infections and a fever, or patients are dehydrated. All three of these added risk factors can be treated and the risk of falls lessened as a result. A lying and standing blood pressure should be measured on all patients who are admitted with a history of collapse or dizziness. Lying and standing blood pressure should be measured first thing in the morning, as this is when it is more likely to be present. As a minimum, it should be measured at least twice in the first 2 days of admission. The procedure for measuring lying and standing blood pressure. Ensure the patient has been lying flat on the bed for at least 5 minutes. Take the patient's blood pressure while they are lying down. Ask or assist the patient to stand up, and take the patient's blood pressure immediately on standing. Wait for 3 minutes, then repeat the patient's blood pressure whilst they are still standing. Abandon the procedure immediately if the patient feels dizzy or is about to fall. For some patients who are unable to stand due to their mobility, a lying and sitting blood pressure can be performed as an alternative. Again, ask the patient to lie flat on the bed and wait at least 5 minutes. Take the blood pressure while the patient is lying down. Ask or assist the patient into a sitting position on the edge of the bed. Take their blood pressure immediately, then wait 3 minutes before repeating the blood pressure again. If at any time the patient feels dizzy or is about to fall, abandon the procedure. Postural hypertension is said to be present if the systolic blood pressure falls by greater than 20 mm of mercury on standing, or the diastolic blood pressure falls by greater than 10 mm of mercury on standing. In the event of an abnormal result, inform the medical team and ask them to review medications urgently. Make sure the patient is well hydrated. Ensure the patient has easy access to the call button and advise them not to mobilise without assistance. There may be a requirement to monitor the patient for postural hypertension on a daily basis until this resolves.